Cicerone. She's an ND hormone specialist. She is the founder of Spark Health, and she's one smart cookie. I send lots of patients her way because I absolutely trust her. She knows her stuff. She's not going to put you in danger. You're going to be heard. It's not a 10-minute in and out kind of situation you're probably used to. So I want to turn it over to Dr. Cicerone. Tell us a little bit about your practice and you yourself. And we've worked together for quite a while. And this is not our first time doing this dog and pony show, is it?
No, and I love it. Thanks, Chris.
Sure.
Hi, ladies. So I started Spark Health almost 7 years ago in Solana Beach. I moved back to California. I'm born and raised California girl. And I moved back to California after working in large hospital systems, doing my fellowship and residency. And I really felt like there was a piece of natural medicine that was really missing in Southern California. The chance for it to be really personalized and be about the patients. And, you know, we're all individuals and we all have such unique needs. And even with something like menopause or perimenopause, every single woman and man for that matter is different, right? So I can have 10 women walk into my clinic with similar symptoms, but what they each need in terms of hormone balancing is completely different. And what's going on in each of their lives is really different. So I started Spark Health so that we could really address our unique individual needs and give patients that personalized approach that was really lacking. So that's always my goal with working with patients, is that I'm taking your unique situation into account and that we're coming up with a plan that really works well for you, financially, energetically, sustainable. We want patients to be an active part of their treatment plan, and that's what my goal always is. I love working with Levita and Chris, and I love working with bioidentical hormones because I think there is a way that we can focus on healthy, balanced hormones and still do it where it's really safe for our bodies. And I think that for me, the FABNO behind my name, I'm a fellow of the American Board of Naturopathic Oncology. So I work with many patients with all different types of cancers and hormone-related cancers and breast cancer. And so it's really important for me to be able to give my patients tools that keep them healthy and happy at the same time.
Excellent.
So should we jump into hormones?
Do it.
So let's talk about perimenopause versus menopause, because perimenopause can begin pretty young and it can last for 10 to 15 years in some women. It's kind of that period leading up to menopause where the hormones are going up and they're going down and they're going up and they're going down and they're shifting and changing, and you might not get a period for 4 months or maybe 10 months, and then you might get one for a month or two. And so it's this kind of up and down time for women. Whether or not we're symptomatic, whether or not we have hot flashes or night sweats or difficulty sleeping, whether or not we have those symptoms, it's still happening in our bodies. It's still something that's physiologically and biochemically happening. And so this is a great time to get a handle on that if you can, and make sure that we're preparing our bodies to have the right levels of hormones that are in a safe and healthy range. And almost, I look at it as kind of sometimes preventing the symptoms that come with menopause. We can keep those levels up so we don't go into this severe hormone deficiency. And, you know, there are different ways that this can be approached. And so I think what a lot of people are used to if they go to, you know, a kind of a conventionally practicing doctor, their OBGYN, they'll get usually synthetic hormones, and a lot of times just estrogen. So they'll get a synthetic hormone that people sometimes will say is natural, pregnant mare's urine, which is natural, but, you know, not ideal. I don't think any of us would love to take that. And so we're looking at different types of hormones that are conjugated, and they're not the same as what our body is making. They're totally foreign substances. Our body doesn't really know how to process them, but there's something that drug companies can patent, and so they can be sold in those kind of conventional commercial pharmacies.
Yeah, there's actually studies out there showing that those hormones can stick around, at least the progestogen parts of them, six months in your bloodstream per the Mayo Clinic. So that's where it can cause some havoc, some long-term problems.
Yeah, you know, when we talk, and we'll get into the details of estrogens too, but when we're talking about how hormones are balanced, just throwing one type of one hormone in large amounts into our bodies is not balancing hormones, right? We want to make sure that we're really looking at how our bodies would naturally function and how our natural hormone surges would happen. And that's why we use bioidentical hormones. So this is what I love about Levita is they're doing all bioidentical hormone replacement therapy. So hormone replacement therapy is often called HRT. As an abbreviation, we call our bioidentical hormone replacement therapy BHRT. So if we refer to it, that's what we're talking about. The structure is identical to the hormones that we are making. That's why it's much safer to use. It's naturally sourced, and we can give patients the exact dose that they need with a compounding pharmacy like Levita. So we're not just saying, hey, take this patch and slap this patch on and you get this dose that everybody gets. I can call Chris and I can say, okay, I want it to be, 1.25 milligrams per gram, and I want it this percent of this and this percent of this. I can be a total pain in the butt and totally picky with her. And she can make that perfectly for me. And that can change from patient to patient with what balance they need and what percent they need. So
it's customizable, not one size fits all.
Yeah. And that's why I love Levita so much, is because they're totally in line with how I'm looking at practicing medicine in terms of giving really customized medicine recommendations. They're doing the same with their hormones and their medications. Bioidentical hormones, you can't patent them. So I love it because it gives us a little bit more control over things. So let's talk about, you have the compounding expert here. So let's talk about what compounding is. And Chris can give you a great on this.
Sure. So a lot of people don't even know what a compounding pharmacy is, but what we are is really a state-of-the-art lab that makes what a doctor like Dr. Cicerone would prescribe to us from scratch with using FDA-approved chemicals. We are inspected by the California Boards of Pharmacy, by the FDA, by the DEA. We're have a lot of regulatory oversight. We do sterile compounding, injectables. Everything that comes to us requires a prescription. We work with all the major hospitals, and we really work all over the country now. So we do customize, as Dr. Cicerone said. What we do, we're problem solvers. Someone could say they can't take something orally. Okay, we'll figure it out sublingually. We'll figure it out rectally or topically or however it is. And we can make things that are not commercially available. So we're the problem solvers, really. And it's important to go to a compounding pharmacy that's accredited. Accreditation isn't required. Levita voluntarily undertook this, 5 years ago now, was our first accreditation, and less than 1% of pharmacies have this level of accreditation. We're accredited for both non-sterile and sterile compounding. And what this means is the doctor can rest at night. When you prescribe a progesterone 100 milligram capsule, you can feel safe. There's 100 milligrams in there, and that when you need to make a dose change, you're basing it on facts. There really was 100 milligrams in there, and it just wasn't underdosed or overdosed. We send things out for testing to independent labs for potency testing, sterility testing, endotoxin testing. We have extensive training for both sterile and non-sterile. All our raw materials come from FDA-approved chemical houses. So again, we're under a lot of regulatory scrutiny already, and then to add the accreditation on top of it, it helps me as the founder and pharmacist in charge to sleep at night. I know that we're dotting our I's and crossing our T's, because it's not McDonald's, it's not fast food, it's medication. So you want it done right.
Well, and it helps me as a doctor also to know that when I'm prescribing medications, they're being done with the highest quality, and it's super, super ethical with how it's being done. I know that I can trust everything that my patients are getting. And so it makes me feel better as a doctor. I can sleep at night because I know I'm taking the highest quality medications that they can have.
And Chris and Dr. Cicerone, I have a question from the chat. I would like to understand the effects that menopause can have on blood cholesterol levels. My cholesterol level went high after menopause and stayed high even though I eat a vegan diet and exercise regularly. Can hormone therapy help this?
Toss that to you, Doc.
It can, and we're going to actually talk about the different functions of the different hormones. Particularly estrogen is related to LDL. Estrogen can actually, the lack of estrogen can increase LDL. I always remember L is our lousy, right? So lack of estrogen will increase LDL, and it can decrease our HDL. H is our healthy cholesterol. So absolutely, it will have an impact.
Yeah.
Any other questions, Helena?
Let's see. I have a question from Margaret. Margaret, you raise your hand. Maybe if you can send a chat question.
And I saw earlier someone had asked if we were going to talk about the muffin top and the saggy skin, and yes, we are later on in the, rest assured, yes.
Well,
I was actually going to ask about how you determine the prescription. How do you know what's lacking hormonally? How do you test that?
That's a great question.
And look, that's really, hi Margot, that's really important. We want to make sure that we get a baseline of hormones, right? So when patients come in, at least in my practice, the first thing that we're doing is we're running labs. Before we're prescribing anything, we're running labs and we're looking at what those levels look like. And then as we look at the symptom picture, so how severe somebody's symptoms are we looking at a combination of hot flashes, night sweats, difficulty sleeping, low bone density, high cholesterol? We're looking at what that, for me, what that symptom picture looks like as well. And then we'll start prescribing. I typically start prescribing at a dose that's fairly low that I know will still be effective for the patient. My goal is to always have the patients on the lowest dose possible where they're getting the benefits of the therapies. So I look at doing a low dose and then being able to increase that and play around with it as the symptom picture changes, but then also tracking values in the labs to make sure that we're at that point where we feel like it's a really safe, healthy number for the patients to be at. And it will have a nice physiological effect. So we want to make sure that we're balancing the symptom picture with the lab work. I've had patients come into me before that that were working with other doctors where, you know, they were just told, just take more, just take more, just take more. And they were taking so much estrogen that their level was, you know, 10 times what a healthy level should be. And it wasn't helping with their symptoms. So we have to look at the hormones then, but then we have to look at, are they taking too much? Is it really making a difference? And are there other things that are contributing to this too, like adrenaline and noradrenaline and things that can rev up our body temperature also?
Right.
So you do this in your own lab? You do a blood test, is that it?
We do a lab draw and then we send off. In my practice, we don't have a lab here on site. We do all of our lab draws here and then we send it to one of the labs that we use to do the evaluation.
Oh, I see.
All right, want to forge ahead, Doc?
Okay, so today we're going to talk about our three main sex hormones, our estrogen, progesterone, and testosterone. I'm going to talk about the thyroid because thyroid is really important, regulating mood, metabolism, hair, skin, nails also. We'll talk about a prescription-only skincare line that Levita does that's fantastic. And then we'll talk a little bit about epigenetics, which is kind of our personal map of our bodies. So let's do a little quiz. Now, I'm not sure how we're going to do the answers. I've never done this on Zoom before, so I'm not sure how we're going to do the answers for this.
Oh, Dr. Cicerone, I didn't mean to interrupt, but there's another question.
Oh, sure.
Where is the natural source of bioidentical hormones?
So they're usually sourced from yam or soy. At all costs, we try to do yam as much as humanly possible. So although they're naturally sourced, they are synthesized in the lab into a powder and a form we can work with. So the key factor is not that they're natural, but that they're bioidentical. It's like a lock and key. Your body sees it as its own, knows how to metabolize and get rid of it.
And that's kind of what we were saying in the beginning, right? You can have pregnant mare urine, pregnant horse urine that's natural,
right?
Completely different from the estrogen that we make, right? So
right.
Natural doesn't always equal good.
It's natural, yeah. Yeah.
Okay, so how will we get the answers to this? And well, I'm not sure if we'll get our participant response, but we'll do a little hormone quiz. So let's say you notice that you're getting bigger around your midsection, you're gaining weight, you're working out, you're eating right, you're not drinking a lot of alcohol. Which of your hormones do you think would play a role in this? Are we looking at high progesterone, low estrogen, estrogen dominance, where we've got too much estrogen, or none of the above?
See, I can hear A, B, C.
So the answer there, we're looking at estrogen dominance. So this is something that can happen when we're looking, and this is why we always say the balancing, right? The hormone balancing. It's not just taking estrogen. It's not just taking progesterone. It's the balance of the estrogen and the progesterone. It's that ratio of your estrogen to your progesterone. This is important all throughout our lives when we're menstruating and having cycles, but it's really important when we're dealing with menopause. So we can look at the types of estrogen people are being given, the types of progesterone and the amounts of progesterone that women are being given, and then what we can also do to help with hormone detox. And if we've got too much estrogen, how do we move that out of our bodies in a healthy way?
Right. And that estrogen dominance, wouldn't you say a lot of your patients present that way? That's where that muffin top comes in. That's where kind of the periods may be getting clotty or longer or heavier.
Well,
That's
and it's tough, right? Because estrogen in the right amount does so many great things. We're going to talk about all of the functions of it. But I always tell my patients, you know, one of estrogen's jobs is to store fat. That's the function we don't like. So yes, it makes our bones healthier and keeps our skin nice and supple and elastic, but it also stores fat. That's part of its job too. So
right.
It's all about having the right amount of it.
Right. So you need it. You just need it balanced.
Like the three bears, right?
Yeah.
Right in the middle.
Right. Exactly.
Okay. So our next question, feeling happy 1 minute, irritable the next, annoyed, your moods are going up and down and up and down. What's causing those mood swings?
Well, it could be your partner, but
Good.
but we'll stay on point.
Yeah. So are we looking at low estrogen, low progesterone, high testosterone, or none? So here's a good situation where we're really looking at a low progesterone picture. Progesterone is calming, it's relaxing, it's an inhibitory hormone. It keeps us feeling like it was cool as a cucumber. That low progesterone can really cause those mood fluctuations too. And like Chris said, there are always going to be other things that are playing a role in this. This is why it's your doctor's job to look at the hormones and to look at your stress and to look at your diet and to look at all of the different things that contribute to who you are, right? And the hormones play a really big role in that. They're a really big piece of that. Okay, let's talk about sleep. So you can fall asleep, but you don't stay asleep. You're up all throughout the night, or you sit there and you toss and turn and you can't fall asleep. So which of the hormone imbalances can cause this? High estrogen, low progesterone, low estrogen, or A and B?
And we just talked about it.
We did. So this is another thing where progesterone really plays a role. Again, it's calming, it's relaxing, it's inhibitory. When you take it orally in a capsule, and we usually, with Chris, we usually do a slow release capsule so your body uses it all throughout the night. When it's taken orally, it can actually really help with sleep. Some women might notice, I experienced this, when you're still cycling and when you did have your period or do have your period, right before you get your period, the day or 2 days before, people can have difficulty sleeping. It's because right before your period, your progesterone level drops. So even in cycling women that are menstruating, those hormone levels go up and down. And when that progesterone goes down, it really does impact sleep. I experience this every month.
Mm-hmm.
So let's talk about our estrogens. So estrogen, we have so many different functions in the body. It helps with insulin sensitivity and balancing blood sugar. It helps regulate our body temperature and control hot flashes. Like we talked about before with the question, it decreases our lousy, yucky, bad cholesterol and increases our healthy cholesterol. It can help with sleep too. It keeps our arteries and actually a lot of our tissues nice and elastic. So we want that flexibility in our arteries and our cardiovascular system, just like we want that flexibility and elasticity in our skin too. It increases blood flow and helps with circulation, which therefore decreases how we have plaque in our arteries. We want that good, healthy circulation. We don't want plaque buildup. We want to have good blood flow and good circulation. A really important piece, I think, is that it decreases homocysteine. So homocysteine is a substance in the body that is naturally made and should be recycled and detoxed. But when it's not, it can build up in the blood and it can lead to blood clots. It increases something called fibrin, and fibrin formation is how we end up having blood clots. So estrogen can actually help with decreasing homocysteine in our body. It also plays a role with increasing our libido and our sex drive, as does testosterone, but estrogen does help with that as well. And I think a really important piece is maintaining collagen in the skin, which helps with tissue elasticity and integrity, helps with fine lines and wrinkles, right? For the vaginal tissue keeps it really nice and supple and lubricated too. And it does cognitively, it helps with memory as well. So estrogen, you can see it's all over the board in different areas of the body in terms of things that it does. Also really helps maintain bone density too, which I think is really important. So this is what we're doing, with our estrogen. We're helping to regulate vaginal lubrication if women are having issues with pain with intercourse and intimacy. Estrogen can really help for that. We use it for treating hot flashes, night sweats, like I said, maintaining bone density. But this is the important piece. There are 3 types of estrogen. We have E1 estrone, O-N-E for 1. We have E2 estradiol, DI for 2, and then we have E3 estriol, TRI, the tri for 3. So these are all different types of estrogen that your body is making, but we don't necessarily use all of them with BHRT. So let's talk about E1 first, estrone. So this is a big source of estrogen in women who are in menopause or have gone through menopause, and we store this in our fat cells. And estrone, I always say, it's our yucky form of estrogen. It does have correlation with increasing the risk of breast cancer. It goes down a pathway that we don't really like in the body in terms of detoxing. And it's not our desirable estrogen. Way before, probably before I was walking and talking, there were doctors that used estrone in hormone replacement therapy, but it's not done anymore.
No.
It's really not a piece
of our own, right? Yeah.
Mm-hmm.
We make enough of our own.
Exactly. We don't want to encourage this type of estrogen. This is a type of estrogen we want to focus on detoxing and getting rid of in a really healthy manner. But we do love estradiol. So estradiol E2 is a really prevalent form of estrogen and really does most of what we think when we think about what estrogen does in the body. It's responsible for those functions. Really important for helping with hot flashes and night sweats, really important for our cardiovascular health, for bone density, for brain function, cognitive function, neurological function. And when we use it in bioidentical prescribing and how Levita makes it, we combine it with estriol, and we call that bi-est because it's 2 types of estrogen. That's the really key piece. I think if I could give you one takeaway today of prescribing and how doctors prescribe, I think this is the really big difference between compounding pharmacies and commercial pharmacies. Compounding pharmacies are making estrogen that's much safer. So rather than just giving somebody, like we were saying, a patch, which is just estradiol, compounding pharmacies combine it with estriol, and we use it as a bi-est cream. Much safer, and I think much more effective in controlling a lot of the symptoms and helping maintain a lot of our important estrogen function. So estriol, E3, it's a very non-potent form of estrogen in the body, but it actually is our protective estrogen. We love estriol. So this is actually protective against breast cancer, whereas estrone is something that's implicated in breast cancer development. And like I was saying, all of the commercial estrogens that you would get do not have any estriol in them. So you're getting a whole big dose of estradiol and none of this protective estriol, which is why I think it's so important that you use this from Levita, because it's only available from a compounding pharmacy. A commercial pharmacy does not have access to this. I also love estriol even on its own, and I use it with patients frequently when it's applied vaginally to help with vaginal lubrication, protect those vaginal tissues, help with dryness. If women are having pain with sex or intimacy, the estriol applied vaginally can be life-changing for them. Even in some of my younger patients, I have patients who have been through treatment for breast cancer and are in early menopause in their 30s, and the estriol is safe for them to do vaginally and really helps kind of give them their sex life back when they're in their 30s after going through breast cancer treatment.
Yeah, and that's a common thing, not the cancer patients, but in general, women come to us a lot with, problems with vaginal lubrication or pain on sex. And so this is actually such an easy fix. It's common and an easy fix. And I think that a lot of women are embarrassed to even talk about it, but don't suffer. We can fix it.
So one of our other hormones that's really commonly prescribed is progesterone. And like we were saying, it really does help with moods, really helping with stress, irritability, annoyance. It's calming, relaxing. It feels really good. It's one of actually my favorite thing in the world to take. Just makes me feel like I'm very calm. I think my staff and all the other doctors like me more too because of it. It does help. This is another thing that can impact cholesterol, is it does help increase our healthy cholesterol. So that's really important. Again, we're always looking at balance. So if we're looking at our bad cholesterol or lousy cholesterol, just having a little bit of a higher LDL, that's not a terrible thing. If you just by itself, you have to look at how it's balanced. What do your triglycerides look like? What does your HDL look like? Again, you're looking at the whole picture. It's not just these one number sitting there by themselves. It's how we're doing it in combination. Progesterone is actually really important too when women tend to get cyclical headaches and hormonal headaches. Progesterone can help a ton with that. Very calming and relaxing. So when we take it orally, helps with sleep at night. We always take it before bedtime in that slow release capsule. So it's used throughout the night to help with sleep, and it has some impact on bone density as well with keeping those bones strong too. Testosterone is what we always think of as a male hormone, right? But it's actually really important with women as well. Really important for energy, for our mental motivation, our physical motivation. It's quite important also for our ability to build and maintain our lean muscle mass, and to decrease fat mass. So we always think about bodybuilders using testosterone for that reason, but it can be done where it's a controlled, healthy dose of it to keep women in that right level where they're not super high, right? Nobody wants roid rage. We want to be in that nice, healthy level where we feel good, we're energetic, we're motivated, we have good muscle mass, but also it can help with sex drive too and ability to have orgasms. So I think for a lot of women, it's a really important part of their sexual health as they age too. So it's not just for men. We're going to talk about men, but it's not just for men.
Oh.
So, men go through this also. We talk about testosterone loss, and it's, a lot of the same symptoms, right? Losing that testosterone. Women lose testosterone just like men do. Levels start to decrease. This is a big part of that kind of tire in the midsection too, with the muffin top or the belly fat. People can get very fatigued with low testosterone. It can absolutely affect mood, for sure. And issues with sex drive, like we were saying with women, ability to climax, problems with erection, it all plays a role in there too. So men and women, we have the same hormones. Again, they're just in different ratios, and that's what we're really looking at. So when we talk about how we make hormones, we're always looking at pathways too, right? So we don't have to memorize this, but I think the take home from this is we start with cholesterol. Cholesterol is kind of our mother hormone, and cholesterol turns into pregnenolone, and pregnenolone turns into progesterone, but it also turns into DHEA. And then DHEA turns into testosterone, and testosterone turns into estrogen. And that's kind of our basic pathway. So when we do talk about hormones, we're absolutely looking at our hormone levels, but we're also looking at what do those precursors to those hormones look like? Where are pregnenolone levels? Where are DHEA levels? Where are those levels that help us actually make those hormones? Where do we get those raw ingredients from, and how is our body making those too? So that's actually something that's really important to test as well. You want to look at the whole picture. You want to look at what testosterone turns into in different ways, what progesterone turns into, the different types of estrogens that are made. You want to look at that, at the whole piece when you're running labs.
Right. I mean, I often get patients who will say, hey, my doctor doesn't really know this bioidentical hormone stuff, but can you tell them what to prescribe based on my lab? Prescribing is only half the equation. You have to follow up, because this is a very basic chart. This chart really could fill a full wall. And if you don't know that your DHEA is breaking down to testosterone and you're taking over-the-counter DHEA, those sort of things, that's when problems arise. That's when you get out of balance. So it's important that you have a doctor that understands this whole paradigm here.
Well, and I think we think a lot of times, oh, it's just a supplement, it's harmless. I have had patients come in where they were taking DHEA on their own and they were feeling, I had this one patient who was my age, she was in her 40s. She was so irritable. She described herself as aggro, mood swings all over the place. Her testosterone was through the roof and she wasn't taking testosterone. She was just taking DHEA. And she wasn't even taking that much. She was taking this itty bitty dose, but how her body metabolized it pushed it to testosterone where her level just went so high, it was uncomfortable and unsafe. So even though it's
and also cholesterol's not all bad. I had a patient once, a male patient, who his cholesterol was phenomenal, actually almost low, but we could not get his testosterone level high. And the doctor kept inching up the strength, could not budge those levels. Then we figured out, well, he's on a statin, and the statin is driving his cholesterol so low that he's not making the testosterone on his own in his body. So the knowledge of this metabolic breakdown is hugely important.
And again, you have to look at all of those pieces, because otherwise you're just playing with hormone prescriptions and not looking at the big picture, right? So like we were saying, more isn't always better, and really oftentimes doesn't really solve the problem either. Gosh, the thyroid. So I would say probably 60 or 70% of my female patients come in and are always concerned about the thyroid, because it's something that we read about so much. And there are a lot of issues that can be attributed to it. So it really does help with our metabolism. Women do have higher levels of thyroid disease than men do. And it's something that I see increases women age too into their 40s and 50s and 60s. So thyroid can impact our cholesterol as well, or LDL. Having an imbalanced thyroid can cause issues with weight gain, inability to lose weight. Again, feeling like you're doing everything right, you're exercising, you're eating well, but you're not able to lose that weight at all. And then a lot of women that have low thyroid will actually have issues with hair loss, with falling hair, with thinning hair, and issues there that they haven't seen before too. And that can be something that shifts and changes, right? Our bodies we're super fluid. We're not static. So just like our hormones change, our sex hormones change as we age, our thyroid hormone also changes. And so we have different ways that we look at the thyroid because we're looking at not only our signaling from our brain to our thyroid gland. Our thyroid is this pretty little butterfly-shaped gland right in our neck, but we're looking at signaling from the brain to the thyroid, and then we're looking at making a thyroid hormone and then how it gets converted into a second thyroid hormone. So it's this whole pathway that we have to look at to make sure that the thyroid's functioning correctly.
And I think it's underdiagnosed a lot. I think a lot of allopathic doctors will run a TSH and maybe a T4 if you're lucky. And then that's how they assess the hormone. And it's just simply not enough information. It's not enough thyroid markers ran.
Yeah, and it's challenging because the Chris was saying, the TSH, the thyroid stimulating hormone, that's our signal from our brain to our thyroid. The lab TSH range can be from like a 0.5 to a 4.7 or something, depending on the lab. So it's this huge range where I like to see patients like maybe a 1 to a 3 in this little narrow range. So a lot of patients, when they have lower functioning thyroid and low thyroid levels, their TSH, their thyroid stimulating hormone, goes high. So patients can have this thyroid stimulating hormone that's, 4.4 or 4.5. It's still within range and considered normal, but it's absolutely outside of what a functional optimal range would be. And oftentimes when a doctor does that test, if it falls within the normal, it doesn't then flag them to do any other hormone testing, actually look at the thyroid hormone values. And that's where it can get underdiagnosed. It's kind of glossed over as, I've been told that everything's normal, but it's not, and I don't feel normal. So what's going on? And that's where having those doctors that really look at functional medicine and natural medicine can really help hone in on that too.
Right.
One of my favorite things that Livita does is they do their prescription skincare line. I'm going to let Chris talk about this because she is the expert in all things skincare related.
Well, I think you start feeling better on hormones and you want to look as good as you feel. So, and hormone deficiency does play a big role there in the aging of your skin. There's a great studies out showing that estrogen deficiency causes a decrease in collagen and elastin, causes an increase in wrinkling. So we actually add estriol to a lot of the skincare, which is that E3, that least potent. I call it least, it's the weakest, but it's mighty because it has a big impact in really small doses for men and women can use this topically on their skin. It decreases wrinkle depth, increases collagen, increases elastin. We don't have to say the appearance of collagen or the appearance of wrinkles because there's studies showing that it actually does do all that. And it doesn't interfere with your systemic hormone levels, so you can use it. It's working locally. We have sort of the greatest hits of skincare if you would like, but we can really make most anything. The doctor can come up and say, hey, I have a patient who's really sensitive about breast cancer and she's being treated. She just would feel better if estradiol is not in there. Fine, we can pull it out. Or there's a fun new ingredient out. Can we use it? We see if we can source it and use it. So we're always creating and tweaking, and my naturopaths have made me kick, you know, a long time ago, raise the bar and make it a really clean line, but it's also clinically effective. So we have things that are for maintenance and for treatment, things for hormonal acne, because when you're a teenager, it's in flux, and when you're 40s and 50s, your hormones in flux, and all of a sudden you're getting acne like you were a teenager again. So we have things that actually address the hormonal aspect of that, excessive hair growth, rosacea, all the things that for treatment, hyperpigmentations, but we also have maintenance. So there's an AM cream, an AM eye serum, and PM cream. I call it nutrition for the skin, and they're really power packed. There's lots of ingredients in them. So I think you get a lot for your money. I mean, it kind of selfishly started this a long time ago for myself because I was tired of going to Nordstrom and dropping a bunch of money on really a glorified vitamin C cream that probably wasn't stable anyway and working. So, you know, I really wanted them to have a lot in them and be active and work, but also be clean ingredients. So do we have, I think we have one more slide maybe on that. I don't remember.
I have another question, Chris.
Sure.
Cicerone. Can the hormones be combined into one pill, or is it recommended to take them individually? Thank you.
Sorry, you guys, I did something with my screen. I don't know what I did.
Okay, I'll jump on that. The hormones can be combined. It's just that some of them you don't want to take orally. I mean, we don't give testosterone orally. We don't. A lot of women want progesterone orally because it helps with sleep. If you take it orally, it won't help with sleep if you apply it topically. So there's reasons why we keep them separate, and there's a argument to be made, especially when you're just starting hormones, to keep them separate because the doctor will know what to tweak if something needs tweaking. If it's all together, it makes it very complicated. But I have seen doctors sometimes combine an estrogen with testosterone in a cream because those are best applied topically. And usually, if I see a combo, I usually see that and then maybe an oral progesterone. But yeah.
Okay, can everyone see my screen again?
I have some questions also. I'm taking a prescription through you, and it's actually to help me with osteopenia, osteoporosis. And I also noticed that it does contain many of the things we've been talking about. My question is, do I need an MD to get to the lab that Aliza is in, or do you have a setup on your own, Aliza?
So the labs that we use, if you're a patient of Spark, your doctor just orders the labs and we do a blood draw for you here in the office and send it off to the lab. So if you're a patient of ours, we just order the labs that we need and then send the prescription to Chris accordingly at Levita. But Chris has a network of other doctors too, MDs, DOs, NDs that all work with Levita also. It just depends if your doctor is well-versed in running the labs and interpreting the labs and then being able to prescribe off of them.
Okay, and then what other tests are not usually given for the thyroid to make the thyroid reading accurate? You said TSH and T4, but you indicated there were more.
There are. So TSH is always done. So your thyroid, then your brain signals to your thyroid makes T4 and it converts T4 to T3. So I always run a TSH and I run T3 and T4, but there are different types of those T3 and T4 that you can run. So there's free and total. Free T3 and free T4. Think of we're free, we're open. It's your most active, biologically active, unbound form of thyroid hormone. And that's the important piece. So we want to look at the free T3 and free T4 also, because some people can have a totally normal TSH. It's perfect. It looks textbook. It's in my optimal range, but their T3 and their T4 aren't right. You can't just look at the signal from the brain to your thyroid. You have to look at the actual thyroid hormones that your thyroid is making and then your body is converting as well.
Mm-hmm.
There are some people that have autoimmune thyroid disease, which means our body kind of sends these wacky signals and makes these little chemicals that can impact the thyroid gland and how it's functioning. So there are also thyroid antibodies if we suspect any type of autoimmune disease or any dysregulation with the thyroid, or if there's a family history of autoimmune disease or autoimmune thyroid disease, we would run those antibodies too. They're called a TPO and a TG antibody. So those are things we would run as well.
I see. TPO, and the second one was
TG.
TG. Okay. And then I take this prescription from my doctor through a cream, and it does have progesterone in it. So I don't know if Chris can pull up my prescription. Is that possible?
I can't now, no, I'm sorry. But I mean, and you can use progesterone topically. That's completely doable, and some patients do. I would say the vast majority do progesterone orally to get the additional side effect of the help with sleep, and the mood stuff is more helpful if it's orally.
Mm-hmm. And then the location on where to put the cream, I've been told to put it in my thighs between my legs, but then someone else said, well, you could put it anywhere. You could put it on your jugular vein in your neck. You could even use it topically. Now, is that correct?
Yeah, I don't know what you tell your patients. It truly, you can apply it to more places than just your inner thigh. They're lipophilic in nature, and even a thin person, there's some fat in the inner thigh, and so that's why that's always a decent place to apply, because it kind of depots in that fat, and then every time your blood pulses through there, it pulls out a little bit of it, and you get a nice steady state. I also have a lot of doctors that like patients to apply it between their wrist and their elbow on the inside of that forearm. I think the biggest thing to remember is to use a lot of surface area. The bigger the surface area, the better the absorption, and wash your hands after, because it can transfer to babies and dogs.
Okay. Then the other thing is wrinkles and hair loss, because I seem to be experiencing that, and I am concerned. I mean, I don't know why that's happening. Of course, I know my age, but there seems to be, like I would say, in the last year. Of course, it's been a stressful year, but
Yes.
I'm still wondering, like you said that you do have specific creams, like yourself. I was going to Nordstrom's and buying Dior, and Dior's very nice because it's all organic, and they claim, and it does absorb really well, but it's very expensive. So what do you have that would be comparable?
Well, it honestly depends. Doctor would have to lay eyes on you. We'd have to know exactly if is it from the sun, is it photo damage, is it aging, just general aging, is it just lack of moisture? There's a lot of different things that can be. Just by even getting your hormones balanced can help with some of that. So it's sort of on a patient by patient basis.
Now, do I get my hormones balanced on my own? How does that work? How do I get that service?
Well, that's between you and the doctor. It's about, communicating with the doctor how you're feeling, lab work, making adjustments as you go, and then you get you know, eventually you get there. Sometimes takes some tweaking. But we have to give some time for other patients to get their
Yes.
questions in too.
I have a question here.
But does that answer your question? I'm sorry.
Yeah, I think
Okay.
the big take home is talk to your doctor. These are all questions that your doctor should be reviewing with you. So if you're not talking to your doctor about this or they're getting glossed over, then maybe look for somebody that's a little bit more compatible with what you're looking for.
Right.
And Chris, I have another question here. Let me see. What is the name of the face creams you just described? This is
Well, there's, you know, that we do have some that are set menu items that we can let your doctor know about. We can send a prescription sheet over there. There's, you know, there's 5 or 6 of them that would be great for wrinkle depth and collagen and elastin. We can tweak them. We can do a lot of things. So if anybody wants to talk about specific things like that, you can call me at La Vida after this, and you know, all week I'm here. I'm happy to answer any of these questions. All right, Doc, why don't we get to the epigenetics piece here?
Okay, so I'm not sure if anyone has heard of epigenetics or knows what epigenetics is, but epigenetics is looking at specific genetic mutations that can impact a variety of things in our body. And you know, I think this kind of became big, you know, maybe about 10 years or so ago with the, you know, the 23andMe, and everybody was doing that. So many of the genes that we look at or that are tested in a 23andMe, they don't really have any clinical applications, right? So you can have these, you know, genetic mutations or genes that aren't mutated, but we don't really know what that means about your health yet. Like the research is still being done, the jury's still out on that. So when we look at epigenetics and we look at what we really need to look at in terms of genes, we're looking at really specific genes. We're not looking at thousands of genes. We're looking at maybe 30 of them, you know, to see how those really apply to health risk, our, you know, state of being, our symptom picture, really what we can apply to what we know about our health and preventing issues. Because remember, having a genetic mutation does not mean that you will have any issue if there is any type of condition associated with that, right? Owning a car and driving does not mean you will get into a car accident, right? Sure, your risk might be a little higher than somebody that doesn't ever drive or that doesn't own a car, but it's not a direct correlation. So I think we have to remember what they always say, your DNA is not your destiny, right? It's simply your DNA, but it gives us information to know when we're talking about preventive healthcare and anti-aging, right? What is anti-aging? We're preventing the issues that come with aging. It doesn't mean we're stopping the clock and you're not getting older. It means that we're mitigating and we're jumping in ahead of time any issues that could possibly come. So based on what's happening in our environment, our external environment, our internal environment, our food choices, our lifestyle choices, we can actually have control over how those genes are represented and what happens. So the epigenetics panel really looks at all different types of genes that can play into how we activate and utilize B vitamins, how we detox hormones, how we make our brain chemistry, our neurotransmitters, things that keep us nice and calm and relaxed, and things that keep us, you know, energized and give us our get up and go. So it's looking at all of these different pieces of that really play a role again into each of our individual makeups, right? It's like our individual terrain and what we can do to influence that in a way that's healthy and positive, and the things that we can look at that we are doing in our day-to-day, in our diet and our lifestyle, that we could maybe shift so that we have a more favorable outcome.
I think having this tool of epigenetics has helped a lot of our doctors, because they'd be stuck. They would say, gosh, I don't know why my patient's so depressed, and we've moved them around on different antidepressants, things like that, nothing's working. Well, they may just have a problem in their, like in the red gear there on the screen, the methylation. Methylation, not being able to methylate well, can lead to mood things, anxiety, depression, panic attacks, even things like that. And sometimes simply giving B vitamins, methylated B vitamins, can fix this. It's not a mutation. It's they call it a SNP. So it's kind of like, we're going to mitigate if there's a traffic jam on the way up to LA, we'll still get you to LA. We're just going to reroute you. And that's what having this information can do for a doctor. Can solve a lot of mysteries that it can explain a lot. Why maybe you're looking like you have high estrogen and you don't. Well, maybe you have defect in an area of detoxification of hormones. And that explains a lot. And honestly, all of these are natural supplement fixes.
Yeah, it's totally modifiable. I think that's the thing to remember is this can all be changed, but you have to know where the issue lies in order to know what you're changing, right? Or what you're fixing. So
Right.
the important piece of doing the testing.
Right. And it's a one-time test, which is very cool. So your genetics are your genetics. Not that you're predetermined to have that outcome, but what they are what they are. And then that gives the doctor a lot of information moving forward. It's pretty exciting.
So, if we're talking about, where do we go from here? I think, how do we feel better, right? So making an appointment, I'll give you my contact information, but it's really any doctor that is well-versed in this, that can really take you through the process. At Spark Health, we have the patient come in for an initial appointment. We really get to know each other. We look at all of your health goals and challenges, what you've tried in the past that did work, that didn't work, your family history, your medications, your supplements, really what you're looking for. We look at labs on a really individual basis. So we'll talk through the labs that we feel are appropriate for each patient. We'll get those results back, and then we sit back down together and we go through all of your results, not just everything looks normal, but this is what everything means. These are the ranges that I like to see if they're different from the labs, and then how that all pieces together and how everything is impacting all the other areas too. And then we'll put together a treatment plan. Again, totally individualized to each patient, with bioidentical hormones if necessary and if applicable, different supplements, IV therapy, if appropriate, vitamin injections, whatever your plan looks like. Everyone's is totally different. And then we make sure that we follow up to make sure that if we're starting a patient on bioidentical hormones, that we're checking their levels in a couple of months to make sure that they're where they should be, that we're having a conversation with that patient about what that symptom picture looks like. So you really want to have a doctor where you're having that personal relationship with them. It's not just, okay, come in, here's your labs, here's your prescription, buy. That's not what this is about. It doesn't do anybody any good, right? As a patient, that doesn't help me at all as a patient when I see my doctor, if they just throw a plan at me and send me on my way. So you want to make sure you understand why you're doing what you're doing and what results you can expect, and then how you want to be monitoring that also.
Right. So that's our presentation. I wanted to just answer any of the last few questions we may have, and then I think we have a couple of giveaways.
Yes.
Yes, we do.
Helena, do you have any other questions for us?
I'm checking right now.
Okay.
So far, I have not seen any.
Can you go back to Aliza's contact information?
Sure can.
Yep.
There it is.
Yes, you guys, you're going to get heard. That's the important thing. And you're going to get heard by somebody who knows what to do with what you're telling them. And for me, that's just a level of relief as a patient, that I feel somebody actually gets it and what my end goal is, and that I want optimal health. And so it's important to work with a doctor like Dr. Cicerone that works in the functional medicine world, that's kind of utilizing the best of all modalities. And she has a gorgeous practice. Go check it out in Solana Beach. Thank you, doctor. It was wonderful. Again, if you guys think of any other questions, you can always reach me at Levita. Again, my name's Chris. My email is chris, CHRS, @levitarx.com. And I'm happy to continue the conversation.
Thank you.
All right, I think we have some giveaways.
Raffle drawings. So I'm gonna.
Helena, can you turn your volume up a little bit?
It's 100%. Can you hear me now?
Yeah, that's a little better. Yes.
Okay. So let's start the drawing right now.
What are we giving away?
We are giving away a 249 value core epigenetics panel.
Oh, yeah, the core panel, it's a value of $249. So it's all the SNPs that we can test.
And our winner is Sylvia Norman.
Sylvia?
Sylvia.
Okay, excellent. Congratulations.
And let's
And we have
And one. It's for $100 off the first new patient from Dr. Cicerone, Helen Buran.
Ah, congratulations, Helen.
And we're doing the vitamins on Dr. Cicerone.
Yeah, any a vitamin shot of your choice when you come into the clinic.
Ooh,
Oh,
that's a goodie.
yeah, like
We
that.
have 14 different ones.
Wow.
Yeah.
And our winner is Lisa Davis.
What was the first name?
Lisa Davis. Congratulations,
Awesome.
Lisa.
All right, so Helena, you'll be reaching out to those patients that won?
Correct.
Correct. And you guys check out the Levita RX website. We have all the future events on there, and also go to the Wine, Women, and Hormones site. Like us on Facebook. You'll get all kinds of good information. Get in to see Dr. Cicerone. She's awesome. You will not regret it, I promise you.
And then I want to plug in the Boys and Brew with Dr. Adam Silverman, October 14 coming up.
That's excellent. Yes. On October 14th, we're doing a Boys and Brew, so it's going to be geared towards the guys. So if any of you guys have a male at home, a man, a friend, a brother, anyone that you think could benefit from that information, I think we give a lot of information to the women and we forget about the poor guys. They need our love too. So it's going to be this kind of thing, but geared towards men. And we've done them before and they're really great events. And the guys get a lot of their questions answered, and it's a comfortable environment to do that. So that's October 14th. All right, guys, I think that's it. Thank you so much for joining us, and stay tuned. We'll have more of these.
Thank you, everyone.
Have a great
Thanks,
day,
Doc.
everyone.
Have a great day.
Thank
Bye.
you.
Bye-bye.
Bye.